Hi, my name is Parker Wiggins, and I will be reviewing my analysis on what makes sleep difficult. I'll be going over the possible variables that impact sleep and hopefully find useful ways to improve the quality of sleep. For starters, I want to go over why we sleep. There are a lot of physical and mental benefits, starting with research suggesting that better sleep improves overall physical health in adults. When there is a lack of sleep, there has been studies done that show children who don't get good sleep don't grow as much, and the development is actually shortened. Getting good sleep has also been seen improving overall well-being, decreasing the risk of disease, allows for better, quicker recovery from injuries and diseases, and improves overall mood as well. Now, the key questions for this specific analysis is 1. Who gets the best sleep? And 2. What prevents good sleep? The goal is to narrow down who gets the best sleep and decide how the people who are not in these very specific categories can improve their sleep. Before I get into the actual analysis, I want to talk about the data. This database was Kaggle sourced. It had 373 observations with 14 columns. First, there was person ID, which was excluded from every analysis, age, gender, occupation, which ranged anywhere from doctor to engineer and salesperson and so on, sleep duration, sleep quality, which was our dependent variable for the analysis, physical activity, stress level, BMI category, which was assorted into 3 different categories, under, normal, and over, heart rate, daily steps, and sleep disorder, which was categorized by insomnia, sleep apnea, or none. The limitations that I saw, or there were 2 main ones at least, were the subjectivity of quality of sleep and stress levels, and the small scale of the database. With subjectivity, it was a ranking on 1 to 10 for quality of sleep and stress level, and the database wasn't exactly clear on whether that was derived from each of the observations or if that came from the researcher themselves based on answering a number of questions. Also, with the small scale, it could be that there were some potential biases that weren't seen just because it is a smaller database, but as far as this analysis is concerned, the data is as objective as possible. Now going over how I prepared the data, the very first data piece that I saw was the blood pressure system. And it was a string variable at first, and I wanted to get that into 2 distinct categories. After talking with one of my nursing friends, they mentioned that the top number, which was the systolic version, and the denominator, which was the diastolic version, could be separated and also have very specific meanings that have to do with health. After I converted those into 2 separate variables, I used the categorical variables and I turned them into numerical, and some of the analyses actually required a binary label for sleep quality of sleep. So in order to do that, I used 6.5, which was recommended by the auto model, as the dependent for what qualifies as good sleep versus bad quality of sleep. Anything under 6.5 was bad quality sleep, and anything over was considered good. Now on to model development. When it came to accuracy and standard error, the 4 best models that I saw were the naive Bayes model, the random forest model, the gradient boost tree, and the generalized linear model. With the gradient boost tree model, it actually seemed to have the highest accuracy as well as the lowest standard error. Now on to model evaluation. When it came to the top influencers, we saw that sleep duration, age, and BMI were both ranked on top for the naive Bayes model, random forest, and the gradient boost model. However, we did have 2 honorary influencing variables, stress levels and occupation, which were both seen to have major impact when it came to overall weight especially stress levels, which was ranked top whenever we're taking into consideration all of the models. And occupation had a lot of different categories, and so it had a lot of influence as well. One of the key notes that I saw whenever doing my analysis was that women and overweight people tended to report a lower quality of sleep. Now looking at key results. One of the first things that I noticed when going over this data set was that any patient who had a less than 7.95 hours of sleep never recorded a higher score than 8 on the quality of sleep. Anyone who recorded 8 hours on the dot actually were the only ones that have any kind of 9 level on quality of sleep, which is really interesting. So the way that it was set up is that it was by increments, so 7.1, 7.2, 7.3, all the way up to 7.9, which is where we get the 7.95. So the research already shows that anything less than 8 hours on the dot already lowers quality of sleep. Another thing I wanted to point out was that there are 2 categories that are manageable, stress and BMI. And so one of the things that I'm trying to point out is that if you are looking for a better sleep quality, then one of the best, or 2 of the best things that you can do is lower your stress and try to keep a healthier lifestyle. We also see that luckily sleep gets easier with age. As you get older, sleep tends to get a little bit easier to fall into, and your quality of sleep actually gets better. So just to reiterate, how do you improve sleep? Well, one, you can get older, but for the most part, lower stress, prioritize your bedtimes because that correlates with the sleep quality or sleep duration, and maintain a healthy lifestyle whenever possible. Lastly, I want to go over suggestions. There's all kind of media attention when it comes to sleep quality and screen time. And so one of the pieces of advice that I have is to include screens when it comes to figuring out how sleep quality is affected. You know, I have a phone and I have a laptop, and using both of them all day could have some sort of impact on my sleep quality. Having one or the other might also do so. It may be that phones have a tendency to ruin sleep quality more than computers, but we don't really have the necessary data in order to make that analysis. One of the other things I would like to see more is the sleep disorder section. It seemed that the sleep disorder section was a little narrow. It only stuck with sleep apnea and insomnia. However, there are lots of other disorders that could possibly impact how people go to sleep. For example, there is the restless leg syndrome, which makes people not be able to sit still while they're trying to go to sleep. And so there are lots of other things that could cause these issues, and I think it's important to point out those disorders because they just aren't shown in this data set. Again, it is a small data set, so it's unlikely to have gotten that kind of information, but it'd be nice to see some sort of attempt at it in the future. Lastly, I really cannot stress enough about the subjectivity of the data set. With the stress and sleep quality, we just really are not sure whether this was from the observations themselves or if this came from the researchers. And so one of the suggestions that I have is to try to do some sort of analysis on assessments. And so maybe instead of asking a patient, how are your stress levels, how is your quality of sleep, try to get some more information. So how many hours do you work a week? How hectic is your job on a daily basis? And so by using these assessments, we can get a little bit more of an accurate statement as to how the stress levels can impact quality of sleep, or vice versa, depending on how the analysis is going. But those are my 3 pieces of advice. I thank you so much for taking the chance to watch my video, and I do look forward to hearing any suggestions that you have on my analysis on why sleep quality should be looked at and how we can improve it. Thank you so much.